Today we are talking about obesity and healthcare risks with our advanced practice nurse and another nurse from our bariatrics department. So we're excited to learn about all the different options and things to make us healthy today. Thank you so much.
Everyone for coming today. I'm just going to tell you a little bit about our program itself. So we are from the Comprehensive Bariatric Program, which is within Sarasota Memorial's healthcare system. We are actually located on an outpatient facility at the Institute for Advanced Medicine. Are you familiar with that, guys? That's where we are down there. So that's where we hold our clinics and our program, and then patients come have surgery up here at Sarasota Memorial. The bariatric program has been in operation since 2004, and it was started by Dr. Pat Fitzgerald in 2004. And since then, two other surgeons joined the program, Dr. John Nora and Dr. Scott Stevens. So within the three surgeons, we cover three different types of bariatric surgery. Bariatric surgery meaning weight loss surgery. And we do gastric bypass surgery, sleeve gastrectomy, and adjustable gastric banding surgery. And basically, at the end, if anyone is interested in learning more about the surgeries in general, you know, we can certainly go over that in a little bit more detail. But so what we're going to talk about today is obesity and healthcare risks. But firstly, I have three questions for you. So I'm going to ask you these three questions, and I want you to just write these down on your paper. Everyone's got a sheet, okay? And there's no pass or fail, okay, for this. It's not a real test. But I just want us to start to think a little bit about obesity. So the first question is, I want you to try and think of a health condition that you think is related. Okay. More questions. So the second question I would like you to think about is, do you think obesity is considered a disease? So that'll be a yes or a no to that one. Okay, and the last one, this is a true or a false. So the question is, almost 20% of children aged 12 and 19 are considered obese. Almost 20% of children aged between 12 and 19 are obese. Is that true? Come back to those at the end. If you have any questions as we go along, however, please do ask, and we'll have plenty of opportunity at the end. Okay. So without further ado, I am going to hand you over to Rodika, and she is going to talk about this.
Is about obesity, which is a condition that has high implications as socially, psychologically, as well as health-related implications. In 1990s, the World Health Organization started sounding the alarm regarding the increased number of overweight and obese people in the world. In 1995, that number was 200 million people worldwide. As you can see nowadays, it's over 600 million people worldwide, which means 30% of industrialized world, wealthy world, is affected by overweight and obesity. In the American statistics, as you can see, probably you have the answer now to your third true and false question, right? 18.4% of children aged 12 to 19 are obese, which means 13 million children are obese and adults over 78 million. And as you can see from the statistics, the numbers are increasing steadily. It is believed that nearly 1 in 5 people who die, they die because they have an associated disease that is linked to obesity. Here we have the map, and we can see the spread of the disease in United States. The largest number of people overweight and obese are in Arkansas, Mississippi, and West Virginia. And Stella is going to talk a little bit about Florida, see where we are with the number of overweight and obese people.
So let's just back up there again to this. So this report, this is actually from the Center for Disease Control and Prevention, and this was the 2014 latest statistics on nationwide obesity. As you can see, though, the report is a self-reported scale of obesity. So really, I don't know how completely accurate this actually is, but Florida, as you can see, is down there in the yellow, and we'll talk about that a little bit more in a minute. Okay, so as you can see from that slide, that no state has a prevalence of obesity less than 20%, or even actually 21%. The lowest state with obesity recorded is Colorado at 21.3%. 5 states and the District of Columbia had a prevalence of obesity between 20 and 25%. There were 23 states, including Puerto Rico and Guam, that were over 25 and 30%. And as you can see, there are 19 states that have a prevalence of obesity between 30 and 35%. And if you go on the CDC website, you can go back, you can do look at these maps and graphs and charts over many, many years, and you will see that the dramatic increase rates as you look at that. As Rodika said, there were 3 states that really are at higher risk currently. That would be Arkansas, Mississippi, and West Virginia, and they are at 35% at least. West has a prevalence of just over about 31%, followed by the South and the Northeast. And it talks a little bit about how the data was collected. So the Behavioral Risk Factor Surveillance System, have nice long names, don't they, for these types of things, is an ongoing state-based telephone interview survey conducted by the state health departments with assistance from the CDC. So when they're calling the individuals on the other end of the phone, they're probably telling them their height and their weight. Again, it's all self-reported, so weights are most likely going to be inaccurate, and heights are probably inaccurate too, because as we all start to grow older, we start to shrink, right? So, that's really a baseline for the statistics, because they probably are much more than that. So if we look, Florida, so let's talk a little bit about Florida. So Florida's obesity rate is currently 26.4%. It has dropped a minimal amount. It was 26.6%. So we are going the right way, but very, very slowly. And 36.4% of Floridians are considered overweight. Colorado, like I mentioned, 21.3% obese. Mind you, they do have quite a high rate of the population that is overweight at 35.1%. So people may say, well, why are they at lower risk in Colorado? Because we have a lot of the similar things that Colorado has. We have a nice climate most of the year, except for the summer, of course. We have a lot of outside recreational things we can do. Climate and the amount of recreational things in Colorado seems to be part of the factors that make their obesity rate lower for some reason. Mention some of those diseases that we can susceptible to when we are overweight and obese.
Now, the National Health and Nutrition Examination Survey between 2009 and 2010 registered almost 70% of of Americans being overweight or obese, which is a huge percentage. In women, overweight and obesity are highest among the non-Hispanic, the black women, which is 82%, compared with the Hispanic women, 64%, and the white, 76%, and white women, 64%. Now, when it comes to men, overweight and obesity are highest among the Hispanic men, which is 82%, compared to 74% the non-Hispanic white men and 70% of non-Hispanic black men. As we said, obesity is linked to a myriad of healthcare conditions. Among them, type 2 diabetes, high blood pressure, sleep apnea, different type of cancers, osteoarthritis, gallbladder disease, back pain, depression, even incontinence.
So, majority of healthcare recognizes the body mass index scale when we look at how do we measure size. Okay, everyone familiar with that? Everyone heard that mentioned maybe at your doctor's office? Yeah. Okay. And it is a measure which is puts you in relation to your height and your weight. It's a calculation, a fancy calculation, which so as healthy individuals, a body mass index is considered 18.5 to 24.9. If you have a BMI of over 25, you are considered overweight. And if you have a BMI of over 30, you fall into the category of obese. And then obesity falls into categories within that range. If you would like to measure your own BMI, it's pretty simple because there are some different calculators out there. You can do it if you go onto our website at Sarasota Memorial. You can calculate it, or if you have a smartphone, like you have there, you can get an app for your smartphone and you can just put in your height and your weight and figure out what you are and see where you're at with that. So one of the things that we put ourselves at risk for with obesity would be coronary heart disease. So as our body mass index rises, so does the risk of us developing coronary artery disease. And that is basically a condition where there's a waxy substance called plaque which lines the arteries, your coronary arteries. It forms kind of a layer around that which can harden up and cause all sorts of problems. It narrows and blocks the arteries and reduces the blood flow. And when the blood can't get to the heart muscle, it can cause angina or, worse than that, a heart attack. Obesity can also lead to heart failure, which is a very serious condition. It's basically when your heart cannot pump enough blood around to meet your body's needs. Heart disease is extremely.
By the same token, if we talk about the adipose tissue present in our body, we can say that the adipose cells, the fatty cells, the number and the size of the fatty cells in overweight and obese people are increased in size and number compared to the lean individuals. As a result of storing fat in these cells, the stressed adipose tissue would start releasing inflammation-inducing factors that will provide a continuous low inflammatory response in our body. And because of that low inflammatory permanent response in our body, a condition called diabetes, if you want to go to the next slide, in which the body blood glucose or the blood sugar is very high. In that condition, the hormone called insulin, which turns the glucose into energy, cannot cannot go into the cell and help break down that glucose because of that transformation that the cells are undergoing due to the inflammation. So in type 2 diabetes, the cells don't use insulin properly. At the first, the body reacts by making more insulin, but over time, the body cannot make enough insulin to control the blood sugar level. And here we have the type 2 diabetes. In stroke, it's kind of the same mechanism as in heart disease. That plaque, that fatty plaque that lines the arteries, some of it can break and just goes into the blood flow, gets to the brain and blocks one of the blood vessels, and there is no blood flow there, and there is no oxygen there, and that is causing the patient to have a stroke.
Metabolic syndrome, you may have heard of that term before. It is named for basically a group of risk factors that increases heart disease and other health problems, such as Rodika spoke about with diabetes and stroke. Risk factors may occur on their own. They may not necessarily be related to obesity, but they certainly can occur together. If you have at least of these three of these following risk factors, then a diagnosis of a metabolic problem might be made, such as a large waistline. So have you heard of people say, like, you have the apple shape and the pear shape? So the apple shape is when you have a large waistline, and that's basically extra fat in your waist area, puts you at greater risk of developing coronary heart disease, and if you have it on your hips also. Quite often we talk about what waistline means you're at risk, and in women it's a waistline of over 35 inches, and in men it's a waistline of over 40 inches. Having a higher than normal triglyceride level. Triglycerides should be anywhere between 40 and 199. So when you have your labs done next, you can ask your doctor, what do yours mean, if you don't already know. Having a lower than normal HDL. HDL is the good cholesterol, which we should have higher than not. A lot of people it's lower. And then having a higher than normal blood pressure. Blood pressure figures have changed. It used to be people used to say, oh, it's 100 plus my age. No, it's not. But blood pressure should be less than 120 over 80. And then fasting blood sugar. Our fasting blood sugar should be between 76 and 106. If it's higher than that, you may need to have further tests to determine am I pre-diabetic or. We're going to talk about this a little bit more at the end. Okay, so being overweight or obese increases your risk for colon, breast, endometrial, gallbladder, and prostate cancers. Osteoarthritis is a common joint problem of our knees, hips, lower back. Basically happens when the tissue that protects the joint starts to wear away. It could be related to age too. As we age, that kind of will wear away too. But if we have extra weight on our joints, certainly we are going to feel that. And joints will wear out quicker. People then tend to have joints replaced. Causes more pain, difficulty to ambulate or move around, then causes difficulty to exercise. Sleep apnea. Sleep apnea is a common disorder that can occur when we are overweight. It can occur also when we're of a normal body weight. But some of the signs of that would be snoring very, very loudly. People observing you stopping breathing at night. Sometimes it's related to the circumference of your neck. If you have a larger neck, you're more at risk. If you certainly have a body mass index of over 35, you might be more at risk of it. And it's really important to get things checked out. A lot of people out there have sleep apnea and they're not aware of it. And they get checked out for it by a pulmonologist, have a sleep study, and then are ordered a device, and then they feel so much better because their breathing is so much better. They feel less fatigued in the daytime. It's a really kind of a miracle thing sometimes wearing that CPAP machine. And as we say here, you know, if you've got more fat around your neck, it unfortunately does start to impinge upon your airway, making it harder to breathe. Okay, so depression and obesity. A lot of people say, ooh, do those two things really go together? Yes, they do. There are certainly new evidence now showing that there's a relation between obesity and depression. As we can see, there was a study of 15 long-term studies that followed nearly 60,000 participants for up to 28 years. That seems like a huge amount of time. And they found that people that were obese at the start of the study had a 55% higher risk of developing depression by the end of it. And people who had depression at the start of the study had only a slightly higher percentage there, 58% higher becoming obese. Though a biological link between obesity and depression has not been clearly, definitively designed, possible mechanisms include activation of inflammation, changes in the hypothalamic pituitary adrenal axis, the brain, insulin resistance, and social or cultural factors. I think depression and obesity also can happen when, because of the way that society does, still unfortunately treats people who have obesity. You know, sometimes there's a lot of bias and stigma and discrimination out there, and that certainly prevents or hinders obese and overweight people from seeking medical help sometimes because they feel they're being judged a lot of the time. So I think that ties into it more from that point of view.
Very interesting association between obesity and cognitive impairment and dementia. In the United States, dementia is increasing and is affecting more than 7.5 million people. It's going to increase more as the population is aging and as we live longer and longer. At age 65, the estimated lifetime risk for dementia of Alzheimer's type is 17.2% for women and 9.1% for men. So good news for men, not such good news for women, right? The good news, though, is for both men and women is that the body weight is a potentially changeable risk regarding dementia, right? Alzheimer's disease. Now, 10 prospective studies. As you can see, they have almost 40,000 people included. There are big studies. And they follow these people even more than they follow them for depression for 36 years. And they show that correlation between dementia and obesity. And that correlation is stronger as the BMI, that body mass index, is bigger in the middle age. As you can see, compare with being in the normal weight range, being underweight, it is associated with 36% risk for dementia, right? But being overweight, it is associated with 42% risk for dementia. Why is that? So you can win if you are underweight. You have to be just normal weight. It is very interesting. As the obesity paradox called, the measurements that were made were also including people at older age in their late 70s and 80s, and some of them already had dementia. And as a precursor of dementia, people start losing weight. So by the time they're fully diagnosed and exhibit the symptoms, they're already underweight. That's why the correlation is stronger with the BMI in mid-age. So as we are younger, definitely we have to lose that extra weight. As we are going older, in order to minimize the risk for dementia as we're growing older. Now, another conclusion of those studies is for the older adult, late 70s, 80s, 90s, we have to pay more attention to the body weight. we have to wait more often these patients, and more studies are going now to look into that and see what is the correlation at that age group. Now, as a conclusion, we can see the myriad of diseases that obesity can trigger, starting with the pulmonary disease, with the cardiac diseases, fatty liver, gallbladder disease, pancreatitis, cancers, osteoarthritis, gout, skin condition, stroke, even cataracts, idiopathic intracranial hypertension. These are the conditions that we know they're linked to obesity. And again, it's in our hands. We can change it. We can watch what we are eating. We can watch our portions. We can walk. We can exercise. We can change our behavior in order to prevent this disease, big disease called obesity, to occur and trigger after itself this myriad of conditions. Like back in the day when we were more industrious and we cooked more, we didn't eat fast food as much. We looked different. Elegant though, back there and now, but we looked thinner.
Done it to us.
Now we have the websites and the references we used for this PowerPoint. You have them in your handouts. You're very welcome to Google them and look for more information for updates on statistics, on the new research going on for obesity.
Okay, so I'm going to ask you those questions again, ladies and gentlemen. Okay. Was everyone able to name a health condition that was related? I'd like to share with what they... Diabetes, yes. Good.
Excellent.
Excellent. 100%. Okay. What were your feelings on obesity being considered a disease? Is that true or? Yes, it is. In 2013, the American Medical Association finally recognized that obesity is now a disease. About less pushing away from the table is diagnosed as disease.
Yes and no. As we said, changing
right,
behavior
yes.
goes a long way.
Like food? Yep.
Active.
Yep. Yep. Burned it off. Oh, wow. Uh-huh. Oh, that's right. You were here for the birthday. Oh.
That's it. Supposed to stop at 1, right? Maybe not.
Yeah. It's hard. You're right. Oh, okay. You have a question for us. Okay.
Very
All
good.
right. Well, let's just answer number 3 then. So I think you probably got this from the first slide, but almost 20% of children 12 to 19 are obese. Yeah.
Yes.
Yep. Frightening, isn't it, really? But on the increase, unfortunately, it's not going the other way, even though a lot of initiatives out there trying to.
Exactly. There is hope. There is hope. There is treatment for obesity. We just have to reach out.
Yes.
Yes.
Lost weight. Right? Yep.
Not physically active.
Yeah. Yeah. Well, it goes back. Yeah. See, we've got all these modern
Gadgets.
gadgets now, whereas
Exactly.
before it'd be go outside and ride your bicycle
And play
Right.
outside football, basketball, whatever. Yes. Yes. Healthier choices. So we hope exercise. They need.
Yeah. Yeah.
Yes, correct.
And there is, if you go onto the internet and you look at Healthy People 2020, that's the next level of initiatives for healthy goals and lifestyles with everything health-wise. That's a good way to look at what's going on and what the government's, what they're involved in and what they're promoting and their campaigns are for certainly for all of us when it comes to obesity. Yes.
Yes.
Yes. It's a government webpage. Yeah. Helpful. I would probably think it's .org. Yes.
I think it's .org.
Yeah.
Smaller portions. But there is always tomorrow. So a small portion for today and another small portion for tomorrow. You just have to plan ahead of time, as you plan
Portion
everything else.
control.
Yes.
Yeah. Well, if you are available on the 18th, our co-worker dietitian is also coming.
Yes.
So Linda, that would be good to come to and follow this process.
She has a PowerPoint presentation like us,
I don't think
and you
she's-
can ask questions and
Yeah, about making healthy choices
Yes.
and things like that.
Yes.
And what we can do, what changes we can make. Simple changes sometimes. Not not sure. We could look into that for you. I know with our bariatric services, we really weight loss surgery. So we don't in our program actually do that, but the hospital does through the diabetes department have outpatient dietitian that works with outpatients that want to. No, you don't. No, you don't have to have diabetes. She's located within that department.
Great.
Oh, good. Line up.
That one.
Yes, please go ahead. Okay. No.
So many books out there.
Yeah, no, I'm not familiar with that one, no. Yeah. So,
Oh, that's why
okay.
it's called 2020.
Don't eat too much of the other food. Oh, okay.
You can look into that. It's interesting to see. Is he talking about behavioral changes as well? Yeah, or
Big part of it.
big part of it. Yes.
Yeah.
And it's about maintaining that weight loss. Here is the behavioral change. Because if you change your mindset while you're losing weight and you think this is what I'm going to be from now on, that is going to stay. If you don't change that mindset, you're going to gain that weight again. You go back in your old habits.
Yeah, easy
Yeah.
said than done
Yes,
sometimes.
it's difficult.
Work in progress all the time. Oh, yes. Our program offers the three, kind of which are the number one, 2, and 3 in the bariatric world: the gastric bypass surgery, sleeve gastrectomy, and then adjustable gastric band. Slightly different. Gastric band includes putting like a silicone band around the top of the stomach. It makes a little pouch so it restricts how much you eat at one time. The sleeve gastrectomy removes a portion of your stomach, just leaves a sleeve, like a sleeve shape. That again restricts how much you can eat. And then the gastric bypass actually reroutes some of your small intestine and kind of makes a little pouch at the top of the stomach, and then the rest of the stomach is kind of separated. The stomach stays there, but food doesn't actually go in it anymore. And that's considered a restrictive and a malabsorptive procedure. It means that's how you lose the weight because of that. But they're all, different types for different people.
Right.
Nope. No,
You can control the portions, right? You can control your portions now.
Good.
Excellent. That's okay.
Absolutely. That will work. Mm-hmm.
Yep.
Yep. They're all laparoscopic procedures. I mean, any type of surgery has a risk, but they're relatively low in compared to a lot of other different types of surgeries like knee replacements, hip replacements.
Usually the surgeon will talk to you about in detail about those risks, so you understand very well what it implies.
Yep.
What this program exactly, because and the programs you are attending, you are going to attend for surgery are very, very important. Our program offers you though that beginning of the whole journey going through surgery, which is 4 to 6 months, when you come each month, and we work with you towards changing your mindset, losing weight, exercising. So by the time you reach surgery, you're different already. Once that surgery takes place, your mindset changed. You know what you have to do, what to expect. And the fact that surgery in itself brings you down so many, many pounds, you become happier instantly. And you want to go ahead and lose more or keep whatever you lost if it's what you're looking for. Your motivation. Yes.
Yeah. Yeah, that's very common. Yeah.
Because you have to combine with exercise.
Change something.
Change everything. Yeah. That has to change. You walk for a while, 3 times a week, 30 minutes. Then you change that walking with brisk walking. Then you increase to 4 times a week. So your metabolism has to be tricked all the time. Yeah,
Yeah.
it's a way of saying
Trigger it
trick.
off.
Yeah,
Yeah.
exactly. Trick.
Welcome.
We thank you for listening.
Linda will be.
Linda will.
Linda will be. Yes.
Yes. Yes.
Oh, you're
Thank
welcome.
you so much,
Thank you for
Mackenzie.
coming.